this lesson, we are going to be talking about hemophilia in pediatric patients. So the term hemophilia actually refers to a group of bleeding disorders that can occur. Patients who have hemophilia aren't able to clot when there's an injury because they are missing certain clotting factors. And hemophilia is caused by an X-linked recessive disorder. And all this means is that females are carriers of the disorder and pass it on to males. So there are a couple of different types of hemophilia to be aware of. And we're going to look at type A, B, and C. Hemophilia A is missing clotting factor 8. Hemophilia B is missing clotting factor 9. And hemophilia C is missing clotting factor number 11. And these are always going to be written in Roman numerals, so I'll show you quickly what that looks like. Clotting factor 8, clotting factor 9, and then clotting factor 11. So hemophilia A is the most common, and it actually accounts for 80% of the cases of hemophilia. Treatment for A and B is quite similar in that you're just giving the clotting factors. Treatment for C is quite a bit more complicated, but you don't really need to worry about that because it's extremely, extremely rare. So what we're talking about here in this lesson is primarily going to be focused on A and B. Your assessment of a patient who has hemophilia is just 100% about looking for signs of spontaneous bleeding. And sometimes this is going to be really obvious, and it's going to be from a cut or an injury, or you might have a nosebleed or a really big bruise that lets you know there's bleeding. But other times it could be happening kind of silently. So let's just talk about a couple of these different ways that it might present. So the most common place for bleeds to occur are in joints. And pretty much the way this is going to present is the child is going to complain of pain in that joint. And then when you go to assess it, you're going to notice that it's red and warm. When you have a bleed that's in the joint, this is called hemarthrosis. And there are some complications that can come along with that, so it's really important to notice when it's happening quickly so that we can treat it. Other places that bleeding can occur are in the brain and the GI system. Obviously, they're not going to be as obvious as something like a nosebleed, but they're extremely life-threatening. So it's important not to miss symptoms that would go along with bleeds in these areas. So let's just quickly think about things that we would expect to see if there was a bleed happening in the brain. So symptoms that you would be looking for here would be visual changes, headaches, a decreased level of consciousness, and slurred speech. For GI bleeds, you're going to be looking for things like a hematemesis, which is when they're vomiting blood, or melena. And melena is when the stool is very dark, black, and that usually means that there's a GI bleed in the upper GI system. When you look at blood work for someone who has hemophilia, you're going to expect to see a prolonged PTT. Their PT times and thrombin times will actually be normal. Management of hemophilia is pretty straightforward. Basically, what we're doing is replacing the clotting factor that's missing. And we give these clotting factors usually IV push. So if a child has a severe case of hemophilia, they're probably going to get these clotting factors prophylactically. If it's a milder case of hemophilia, they may only get the clotting factors as and when they need them. For the more severe cases, you can probably expect that the patients will have a central line, and this is just to avoid having to start IVs every single time they need an infusion. An important medication to know about is called DDAVP, and DDAVP is actually the same medication as desmopressin, and it's given through an IV infusion. This medication only works with mild hemophilia A, and that's because we're not actually replacing clotting factor 8. What the desmopressin or DDAVP does is it actually works to stimulate the body to release more of the missing factor. So it's not replacing it, it's stimulating the body to release more. So I mentioned before that a really common place for bleeding to occur is in the joint. And when this happens, and when it happens frequently, the soft tissue and the surrounding areas can become damaged. So it's really important that our patients with hemophilia get physical therapy to make sure that they don't end up with contractures that could affect their development. So the best way for hemophilia to be managed is at home. So parents are going to be educated on how to either start IVs or access central lines so that they can give the factor when their child needs it. And this basically just makes sure that kids get the treatment as quickly as they possibly can and that it's having minimal impact on their daily lives. So to make sure that these patients can be managed at home as much as possible, we need to make sure that parents and kids are aware of the following things. So they obviously need to be pros at administering first aid and stopping bleeding. They also need to know that these kids cannot play contact sports. We can't risk them getting bleeds from those types of injuries. And then also it's really important to know that they should never ever give aspirin or NSAIDs for pain or for fevers because they can cause bleeding too. Protective gear is really important for any kind of activity that they're doing, especially for accident-prone toddlers and preschoolers. Your priority nursing concepts for a pediatric patient who has hemophilia are going to be clotting, oxygenation, and safety. Okay guys, that's it for this lesson. Hemophilia is pretty straightforward. And it's great to know that actually kids with hemophilia do really well and have a great life expectancy if they can manage it properly. So let's recap really quickly. So hemophilia is an X-linked recessive disorder where the patient is missing a clotting factor. Remember, hemophilia A is missing clotting factor 8, hemophilia B is missing clotting factor 9, and hemophilia C is missing clotting factor 11. Your assessment of a patient with hemophilia is all about looking for those signs of bleeding. So remember, we're looking for the obvious ones and also those less obvious ones like the ones under the skin, so joints, in the brain, or in the GI system. Our treatment is all about giving patients the infusion that will replace the factor that's missing. And just remember, management is best when it's done at home. So our parents and kids definitely need to know how to prevent bleeds, and then also how to administer their own clotting factor. All right, that's it for our lesson on hemophilia. Make sure you check out all the resources that are attached to this lesson. There's a cheat sheet on the clotting cascade if you need a refresher on the patho. Now go out and be your best self today, and happy nursing.